I'm Dr. Amrendra Singh. I'm cardiothoracic and vascular surgeon at Care Hospitals, Malakpet. So many patients comes to us after coronary bypass surgery or stenting, and they ask us what to do next. How should we lead our life, and what modification should be done. So many times we talk about prevention, but I thought today we'll talk about these things. So first of all, foremost, we have to understand that coronary artery bypass surgery and stenting are just palliative procedures. Palliative means we have done surgeries or stenting to improve the blood flow to your heart. But disease is still there. Disease is known as atherosclerotic disease, which will be there with you always, so that may create fresh blocks, or the graft or stents we have put in, they may also get blocked over the period of time. So we cannot 100% stop them, but we definitely reduce the rate of progression of these blockages. So as Albert and Einstein has said that we should make things simpler, if not totally simple. So we want to make some lifestyle modification after bypass surgery or stenting. First of all, most important thing is please take regular medication as advised by your physician and surgeon, and especially patients who are hypertensive and diabetics, they should control their diabetes and hypertension. Diabetic patient to take care of their dietitians to modify their local diet. They should take as much as possible the local diet which is readily available and freshly available. We should not be, there is a concept of food miles, that the more food comes from more distant places is good. That is like apple coming from Washington or New Zealand or Kashmir is not going to help you better vis-a-vis your guava and papaya and watermelon and mangoes. These fruits are always available locally and produced in 10 to 20 miles in the city area. So these fruits are always better. So try to take these fruits as much as possible. They will reduce your cost as well as your calories also, because these fruits are really good, which are produced locally they are full of vitamins and minerals and antioxidants which they provide. So these are the what about the diabetic patients ask about what food should be used. So mainly the low glycemic index food, like locally produced mota anaj, which call them like jowar, bajra, and ragi. Mix them. If you cannot use the whole of them, then mix them in your wheat and then take to reduce their glycemic index. Try to take as much as hand pounded rice or brown rice, we call them, which were used in our villages. Try to take more of them. Try to reduce the intake of white things in your food, like sugar, like white rice, like that arbi, colocasia, or arbi you call it. So yam also in the same category. Shakarkand also in the same category. So try to reduce as much as possible the white food in it. Try to take more colorful things in your all green leafy vegetables, carrot. You can exceptional to radish in this thing also, because radish is mostly white. So these are about the dietary modifications. Second thing is your exercise. We are not asking you to do very heavy strenuous exercise. If you are doing it, you can start them after a few months of surgery or PTCA again. But if you are not, and you are not doing before, then please start at least simple walking. Start with 10 minutes, 5 minutes, and continue for increase it to 3 kilometers, 4 kilometers in 45 minutes periods. If you do these simple exercises, even cycling or jogging or third thing is swimming can help you in in these lifestyle modification. So for today, this is enough. If you have any queries, please do write back to us. We'll try to solve them as much as possible. Thank you so much.